Hello and welcome to Trib Talk, a production of the Salt Lake Tribune. I'm Nate Carlisle, a reporter at the Salt Lake Tribune. Is Salt Lake Tribune crime and justice reporter and chief of our Ogden Bureau, Jessica Miller. She'll be talking to you today about outbreaks in jails and prisons in Utah. We'll also be talking with Dr. Allyn Nakashima of the Utah Department of Health. She concentrates on helping prevent infections in healthcare facilities. Dr. Nakashima, thank you very much for being with us today.
Glad to be here.
And we are discussing the pandemic in what we call institutional facilities, nursing homes and other types of long-term care facilities, jails and prisons, and we'll also get into discussion of workplace infection as well. One preface we ought to state at the beginning is that right now the most common way to contract coronavirus, according to the Utah Department of Health's data, is social infections, household interactions, catching it from someone else in your household. So even though we're talking about places maybe not that many of us live, don't think those are the only places to catch coronavirus. But let's talk a little bit about what the data is showing about starting with long-term care facilities. According to the latest data available from the Utah Department of Health, there's been 217 facilities, long-term care facilities in the state of Utah that's had at least one coronavirus case, staff or residents. That's about roughly 2/3 of the long-term care facilities in the state of Utah. Now, the good news is that of those 217, 179 have had their issues resolved. But we have had 80 deaths in long-term care facilities due to COVID-19, and there's been 483 healthcare workers that have been infected at some point, as well as 573 residents. And there have been some very severe outbreaks. Recently, the most serious one has been at the William E. Christopherson Veterans Home in Salt Lake City, where at present 13 veterans or residents of the facility have died. There's also been a memory care facility, the Ridge Foothill in Salt Lake City, that had a similar number of deaths. And there have been deaths at the facilities really up and down the state. We'll talk in a few moments about outbreaks in those kinds of facilities, but let's kick it to Jessica for a moment. Jessica, just give us a quick rundown of the coronavirus infections we've had in jails and prisons in Utah.
Right. So it's kind of interesting. Across the country, there's been outbreaks in jails and prisons, since March, pretty much since the virus started spreading in the United States. But for a long time, the prisons and the jails in Utah weren't experiencing much spread. And that somehow all of a sudden has changed very quickly. Washington County has had about 100 of their inmates test positive. That's about 1/3 of their inmate population right now. Weber County has had 82 cases, which is, I think, about close to 20% of their population. There's been a handful at the Draper prison, and then 23 total in the Salt Lake County jail. So this is something that's just recently, in the last week or so, starting to infiltrate the jail system and getting into some of the incarcerated facilities. And generally, do they know how this got into the jails? Was it a new inmate they took in? Was it staff or what? In Washington County, they traced it back to their intake unit. So it was somebody who had been brought in from the jail. In Utah County, there actually was a case where someone was tested positive when they were being brought in, and they just had her go home. They never brought her into the jail. In Weber County, they had a federal inmate who was transferred from another state that had an outbreak at their federal facility, and that's what brought it into the facility in Weber County, which, was pretty upsetting to a lot of the inmates there. That this is basically a contract. The county was getting money to bring in somebody else who didn't live here, and then that's one of the ways that the infection started at Weber County, at least.
Okay, so let's go to Dr. Nakashima. Doctor, what do you see in Utah in terms of where is the state having successes in combating the virus at long-term care facilities and other healthcare centers, and where do you think we're still having trouble?
Okay, so across the country, the data is showing that it really isn't the facility, the quality of care in the facility isn't what determines what comes into the facility. It is the disease is coming from the community. So when you see spikes in disease in the community, then we're going to see spikes in the number of healthcare facilities that get this infection introduced into the facility. Now, these facilities have all been locked down since around March, so they're not having very many visitors. They essentially are doing all the things they need to do to keep the disease out, but of course they have to have healthcare workers come in. I would say at least 90% of our outbreaks that are occurring in long-term care are due to healthcare workers out in the community. They're part of the community, and then they bring it into the facility. Now, Utah has been very successful. Actually, we're a model across the country for limiting the spread once it's introduced. So it's really difficult to keep it from getting introduced into a facility. But once it's introduced, we're pretty good at limiting the spread as much as possible. And that reduces the number of deaths because it's a very vulnerable population. So if they end up getting hospitalized with these, their death rate is very, very high. So, but by working with the facility very closely right at the beginning of their outbreak, we can limit the spread and make sure that as few as possible get infected in the facility.
I'm going to pose a question to each of you in a moment. First, I want to tell anyone watching this that we want to hear from you. What questions do you have about long-term care facilities and jails and prisons in Utah and the outbreaks there? Do you have a loved one that is in one of these facilities or has already gotten sick in one of these facilities or passed away in one of these facilities? And what did you observe and what do you want people to know? We'll take those questions in a moment. First, Dr. Nakashima, let me ask you something. You talked about how these facilities have worked with the Utah Department of Health. Thus far, can you say, has any of these facilities let this virus in just out of sheer negligence or failing to do what they should? Or is it just something that you can't be helped and it's just that tricky a virus?
Well, it's an airborne virus, as I said earlier. So with an airborne virus, if you're in the community, you're part of the community, a healthcare worker can get infected at any time. Now, we do education, and many of the facilities are doing this to ask healthcare workers to be extra careful out in the community. So to avoid places, indoor places where other people are not masked so that they don't get infected. I think the facilities are doing a pretty good job with that. We also, mid-April, long before the CDC actually recommended this, they do recommend it now, we asked all the healthcare workers in these facilities to use a mask, at least at the minimum, every time they had an encounter with a patient in the facility. Now, what that's done is that's made a lot of our outbreaks go nowhere. In other words, when the disease gets introduced, if the healthcare worker is very good at wearing their mask, their face shield, their gloves, that PPE with every encounter, we have quite a few facilities where there is no spread at all. It comes in, the healthcare worker has it, but none of the patients get it. So that has worked very well for some facilities, but again, early on in the outbreak, we didn't have as much PPE as we do now, so that was actually a big problem with a lot of facilities.
Jessica, what about the jails and prisons? I know these aren't typically considered healthcare facilities. But do the guards there, are they routinely wearing any kind of PPE, and what other steps did they take to try to prevent an outbreak?
There's been, some conflicting information, and that's kind of, changed over time. Where the facilities will say that the guards are wearing face masks, but some of the inmates that I've spoken with or their families say that that's not always happening. So it's been kind of a mixed bag that way. But most of the inmates at this point have been given at least one or two cloth masks. The soap that they're given that soap freely. They don't have to pay for it with commissary anymore. They've been doing some education as far as like social distancing and things like that, but that's obviously a challenge when you're in dorm style housing, and you can only control so much. You can control yourself, but maybe not the inmate next to you who may or may not be washing their hands or doing some of these other things. So they've been trying, but it is difficult when you're in that kind of environment and living in very close quarters with other people.
Mm-hmm. I've kind of observed, Jessica, from your reporting, that when there is an infection or an outbreak, the jails basically do what some of the nursing home and long-term care facilities have been doing when they have one. They try to basically get all the infected into one wing or one corner of the institution to isolate those patients. But then with the long-term care facilities, they're careful to not send the same staff into the COVID positive portions of the facility that they are, the rest of the facility. In other words, they isolate the workers too. Do you know, are the jails doing that with their staff? Like if you're a guard in the COVID positive wing, are you then allowed to go work in the rest of the facility?
That's a good question, and I'm not sure the answer to that. I know I've spoken with some people, a couple of family members who's had their loved ones test positive at the Weber County Jail, and they tested an entire unit and went in and just took out a handful of people, and that's when they kind of realized, oh no, we're the ones who have it, like we're the ones who tested positive. So they're definitely doing that, where they're keeping everyone who tested positive kind of in those same dorm style rooms, but then taking those that are negative and putting them somewhere else. But as far as staff mixing, I'm not really sure about that.
Okay. All right. Dr. Nakashima, I don't know how much you've been advising the jails and prisons as well, but I mean, if you were to give them some kind of advice, would it be pretty much what you're giving the long-term care facilities, or do you think there might be something unique with the jails and prisons?
Well, I think that you have to look at how the infection comes in. So, for example, in the long-term care facilities, I said it was the healthcare workers. I don't think that's the case. It's not the staff there that introduce it as much as inmates. So they might put in screening and quarantining of new inmates before they put them into the regular population of that jail. So in other words, when a new person comes in, or if they can divide their jail into new entrants and the people that are established there for that couple of weeks, have people go ahead and quarantine there for 14 days before they get introduced into the regular part of the jail. But I don't know if that's possible, because they got space limitations just like long-term care facilities do.
Yeah.
So,
okay. But
we recommend that actually for new admissions to long-term care as well. There's been a few outbreaks where we've had that happen, where a patient comes in from a different facility, or from home, or from a hospital, and many of the facilities are quarantining them or putting them in a separate room and not letting them mix with the regular population for the 14 days.
Yeah. So we do have a couple questions coming in, and we'll get to those in a moment. Jessica, I want to ask you one other question. To what extent are jails not taking the same number of inmates they once would have, or not booking the same amount of people? I mean, do we have a sense of how concerted an effort this is statewide, or is it pretty much like the rest of the coronavirus response? It might depend a little bit on which county you're in as to whether the jail is going to book that individual.
It definitely is something that varies county by county, but most counties I've talked to have tried to, make significant strides to reduce the jail population, have been at historic lows. Salt Lake County in particular, I haven't looked at the data lately, but they're, 1,000, maybe more or less than they normally are. They're really working to reduce that inmate population. And even like in Weber County, where they're having this outbreak now, they have about a third less than what they normally do. And even that isn't giving them enough space to quarantine new inmates for the 14 days as recommended. They can for the women, but for the men, they were looking at maybe only like 3 or 4 days was all they could do because of the space limitation. So it's something that they are continuing to reevaluate. What type of people can we let go and have them not be a safety risk? That's obviously the balance you have to strike here when you're talking about people who are incarcerated. Maybe nonviolent offenders can be released or serve their sentences in other ways, but then there are others who are accused of very serious crimes that are not likely to be released. And how do we balance that, I guess? And that's something that they're even struggling with now in Weber County as it's coming in. They've let some inmates out, but they still need more room. So there's going to be more discussions about, can this person serve their sentence in a different way that frees up space and also doesn't expose them to the virus.
Mm-hmm. And we've talked a lot in the last 2 minutes about the county jails. Jessica, what's the status of Utah's 2 state prisons?
The state prisons actually have been pretty coronavirus free. I think there's been 3 cases in Draper. Most of the prisoners right now that have tested positive, early on there was like a halfway house where there had been 11 people who had tested positive, but most of those people have recovered at this point. The prison population that we're seeing that are getting coronavirus right now are actually those that are at the county jails because of overcrowding. The prison pays county jails to house those inmates. And so it's kind of the same situation with maybe a local Weber County person. They also are sending the prisoners to these county jails as well. And that's where they're getting infected.
And the jails generally have more people coming and going than the prisons do too, right? I mean, if you're sentenced to prison, it's probably for a matter of years. Whereas if you go into the jail, it might just be, while you're pending trial or something like that.
Right, exactly. Yeah, you could be in a jail. I mean, a lot of them are in for less than a week. It's kind of a rotating door there. There has been an effort of local police to cite people rather than taking them into jail and booking them into jail and leaving them in there to kind of keep that revolving door, slow it down a little bit. So at this point, most of the people that are booked into jail and stay there usually are for a little bit more severe crimes or like DUIs, domestic violence, those sorts of things that kind of have a danger to society aspect to it. Okay.
Let's get to a couple of questions we had now. This one's coming in from Facebook, named Danny. He says, the Utah Healthcare Association said in a legislative hearing in June that assisted living facilities and nursing homes are struggling to get PPE. Is that true, and what can be done to address that? Also, are workers in these facilities required to do symptom checks every time they come to work? I'll run both these past Dr. Nakashima. First, what is the PPE situation? Personal protective equipment, for those of you not up on the lingo. So face masks, gowns, could be hoods and gloves. To your knowledge, Dr. Nakashima, do all the long-term care facilities in Utah have enough access to this right now?
Well, I mean, honestly, they don't have as much as they would like. Most of them have now solved the masking problem, so they're doing pretty consistent masking, which was absolutely not true at the beginning. Like in March, we really didn't have any PPE out there, but there is still a lot of struggle with getting things like gowns, face shields, and then they run out often. So we have set up a system with our local health department. So when the state receives supplies of PPE we distributed out to the local health departments, and then they distributed out to the long-term care facilities in their jurisdictions. That's worked pretty well, especially during outbreaks. And for when we have an outbreak in a facility, we actually work very hard to make sure that they have enough PPE during that outbreak to handle what they need, what the situation, and get through it.
Would you be able to say whether you could attribute an outbreak at one of these care facilities to them not having PPE? I mean, has that been a factor to your knowledge in any of these outbreaks?
Well, I think early on it was, and we didn't actually have that recommendation in. I told you in beginning of April, we put in the recommendation to put a mask on at least for every encounter. So now I think there's enough PPE that people can do that part, and that's the main thing, because I said, this is an airborne disease, so they have that. We'd like them to have face shields, because that preserves the mask better and also adds some protection. So those are a little bit more difficult to get, but gradually we're seeing that most of the facilities are getting those as well. But yeah, early on, I definitely think that people weren't able to, or didn't even think they needed to. And the person asked about symptom checks. So early on, that came out at the very beginning of the outbreak, that everyone thought that symptoms were the way that we could keep it out of a facility. That is not enough. Most of the transmission occurs from pre-symptomatic or asymptomatic workers. So just checking their symptoms every day, they all do that, but that's not enough. So they need to wear that PPE all the time.
What's the status of testing for long-term care facilities, Dr. Nakashima? I mean, at this point, is it still just being done on a sort of a after-the-fact basis? You think you've got a positive test and then everyone gets tested, or is there any proactive testing for these facilities at this point?
Well, actually, proactive testing is not very useful. I think people have that impression that you should go in there and test people every week or something like that. That is so logistically difficult and really impossible to do. I mean, they're in any facility, they've got hundreds of healthcare workers, and to get them organized to get tested every week is nigh on impossibility. And testing, we did this because the president asked CMS to do this, and we all the governors, I think, were on board with trying to test all the nursing care facilities in their jurisdictions. Test them at least one time. So we started that process. Well, it completely overloaded our laboratories, for one thing. And then the other thing that it did is it's very low yield. We only found 2 out of 82 facilities that we tested had a problem. And, that's very low yield. I mean, that was like 2 out of probably several thousand healthcare workers that we tested. So that really isn't a very cost-effective way of actually finding these outbreaks. I think that being proactively trying to teach your healthcare workers to do the right thing, which is avoid places where they're indoors with some of the people not masked. If you're in close contact with anyone, just like the public needs that message just as well as healthcare workers, is that to prevent this disease, if you're within 6 feet of somebody, you need to wear a mask, and they need to wear a mask. You wearing a mask protects them, but they need to wear a mask to protect you. So if everybody could just wear those when they're in that situation, that would really reduce a lot of transmission. And what we're trying to have healthcare workers do is be cognizant that they are in a high-risk situation, so they need to prevent themselves from getting infected as much as possible.
Okay. This is a question from Heather on Twitter. What is the plan in areas with 0 cases, deaths, or in the green? I think she's referring to the green designation that the governor's office is devised. Will they be allowed by the health department to see their family? So I think basically the question is, if you're in one of these counties in Utah that's currently designated green, and everything looks pretty good in that county, should that long-term care facility go ahead and open itself up to visitors, Dr. Nakashima? What's your suggestion there?
So we just put out guidance on our website for assisted living facilities. We started with those for safe visits. And we think that they can be done safely. A lot of people haven't seen their loved ones for many months. And so especially in a green area, there are guidelines now online for them to have a safe visit. So that really depends on the facility. They have to decide whether they want to follow those recommendations and have safe visits. Part of it depends on their capacity, because we're requiring for those safe visits for the visitor to be in PPE, if possible for the visit to be outdoors, so that there's less risk of transmission, and they need to be supervised. That is, the facility has to provide a CNA or somebody that supervises the visit to make sure that everyone stays safe. So that's, if the facility can accommodate that, we have recommendations online for that now. Nursing homes and skilled nursing will probably have those same kinds of recommendations. They're even more restrictive, because we actually put on there, if they're in an area that's green, that's fine, they can have visits. But if they're in an area that's orange or red on that map, they should not probably start that, because it's too risky.
Okay. There's some good information. I think we just made some news here, because I for one hadn't seen those recommendations yet. Okay, here's another question we have also from Heather on Twitter. I don't know if it's the same Heather, but she's asking what's being done about minors working in long-term care facilities. I mean, I know I've seen, like, some high school kids maybe working part-time in care facilities and stuff, but I mean, are those the care facilities are pretty much, the staff's just limited to essential personnel at this point, isn't it, Dr. Nakashima? I mean, are they?
Well, I think where you'll see this, and there's something to address this right now. You might see it in, for example, housekeeping or food service, something like that. And it's because there's such a shortage of workers right now for certain types of work and all in those facilities, and also healthcare workers. They're under a lot of stress, so there's a lot of people quitting and things like that. But I think that the main thing for those types of workers is that they get the proper education around what they need to do to stay safe, because they are working in a long-term care facility. There's a new project that the Centers for Disease Control is just putting out called Project First Line, and it's targeted specifically toward lower level healthcare workers or staff in the long-term care facilities and hospitals, so that we'll be teaching them, and we're going to probably develop a video around that to make it a pretty accessible and not too long and fairly simple language kind of video, so that they can understand that they really need to do some things to keep themselves safe when they're coming into the facility every day.
Okay. Let me ask you something my own family's grappled with, and then our time is up. Do you necessarily recommend moving someone into a long-term care facility at this point? Would you tell families they're better off keeping their loved one at home, or is that a sort of sliding scale question based on the factors in each household?
I think it really depends on the individual situation that you have. I mean, most people do send their loved ones to facilities only because they can't manage them at home. And so I don't think that's changing very much. I think that it's always a difficult decision. I took care of my own dad at home, and I thought about it many times, because it's really difficult to send them to one of these facilities. But I do think the facilities are doing a pretty good job. Where we could look at it, I think Utah has one of the lowest levels of deaths in long-term care facilities in the country, per capita numbers, when you actually look at the numbers per capita. So I think our long-term care facilities are as safe as can be right now. Again, I said that things change when the community changes. So the healthcare workers that work in these places are part of the community. So as long as we're in the red, or we're having increasing trends in the community, that's what we really need to get a handle on. We all do, to make it safe for everybody.
Okay, and we're going to have to end there. Dr. Nakashima, thank you very much for joining us today. Jessica Miller, thank you very much for joining us today. Trib Talk's a production of the Salt Lake Tribune. Thank you, everyone, for watching and sending in your questions. Please watch for another episode of Trib Talk one of these days or next week. I'm honestly not sure when the next one is. We kind of schedule these as we can. Everyone, stay healthy, stay safe. Bye-bye.
Thank you. Bye.